Thank you. Good morning and welcome.
Good morning, Mr. Chairman. Thank you, and members of the Senate Judiciary Committee. Thank you for the opportunity to testify and for your endurance, obviously. My name is John DeLuca. I was born and I've been brought up in the city of Providence. Been there all my life. My day job is social services. The debate concerning same-sex marriage in our state has heard philosophical, theological, and sociological arguments. Both sides express their views, leaving a margin of interpretation. There is, however, one approach that clearly points to solid, concrete, empirical data that demonstrates the dangers to the health of our society if the homosexual lifestyle is promoted. The argument against same-sex marriage from a public health point of view is solid. Our own Rhode Island Department of Health conducted a study in 2006 on HIV/AIDS that indicated that 78% of the HIV cases reported to that date were male subjects. And of those males, 3/4 of them self-declared to be actively engaged in homosexual activity. Some of the remaining 25% of the males could have been engaged in homosexual activity but did not declare so. Others contracted the virus through heterosexual activity, and others were drug addicts who were using contaminated needles. So homosexual activity was by and large the source of males contracting the HIV virus during that study. In 2011, the Rhode Island Department of Health conducted a similar study which found the following. A total of 3,100 cases of AIDS had been diagnosed in Rhode Island from the time it began monitoring AIDS statistics in the early 1990s to the end of 2011. From the beginning of the epidemic through 2011, 1,523 deaths from AIDS occurred in the state of Rhode Island alone. In 2011, there were 2,014 persons living with AIDS in the state of Rhode Island. And in the calendar year 2011 alone, 97 new cases surfaced that indicated 83 men and 14 women had positive HIV tests. Most of the men declared that they had had sex with other men. It's believed that many other people were infected, but don't realize it. The evidence is in, and it's clear that homosexual activity is the greatest breeding ground and source of HIV/AIDS. The mission of the Rhode Island Department of Health, in their mission statement, they state their mission is to protect and promote the public's health. The Rhode Island legislature is a responsible body who should be supporting its own Department of Health. Passage of the same-sex marriage legislation, and this is the important point, it could be perceived by the young and the naive as an endorsement of a lifestyle, which then could lead to experimentation and thereby exposing new participants to life-threatening and debilitating diseases. State legislators in Rhode Island should set the example and lead the nation in denying same-sex marriage based on danger to public health. Theological, sociological, and philosophical approaches also have their merits in the debate. But the health statistics are the most convincing argument against same-sex marriage legislation. Please keep public safety for this generation and future generations in the forefront and consider voting against the same-sex marriage. Thank you.
Are there any questions or comments? Thank you.